Dr. Bilski, normally when you think of the old dentist, I'm going to the dentist, the pain and all that, but there is actually, I'm looking at it here, there can be a painless infection I have in my mouth.
Right.
2 questions. Number 1, how do you treat it? What do you do with it? And first question, how would I know I have to have it treated if I don't feel anything?
So that's a good point. So a lot of people, let's start with that one. You have an infection, you don't know. Well, you came to the office, we're just cleaning your teeth. I had a younger man in today. He has a little gum pimple above one of his teeth, right on the gum. And we've seen it before, and hey, is that bothering you? It's not bothering you. Like, okay, next time we see you, let's evaluate a little bit more. And we did do that. And this gum boil is about the size of a number 2 pencil eraser.
Oh,
so it's pretty good size. That's about more than 10 millimeters, which is big. It doesn't hurt. The reason why it doesn't hurt is because it's actually leaking through the gum, not creating pressure, where most patients with toothache pain, that gum swells and the cheek swells. So the facial planes, they're called, swell, and that's what hurts.
That's what's hurting. Okay.
Yeah. So not only do we have to deal with the tooth problem, sometimes it's eradicate the tooth, meaning remove it.
Yeah.
Sometimes it means root canal, which is another episode of the Bilski Dental videos here. But root canals are safe. They are good. There's a lot of bad literature on there. What I'm saying is it's what's best for you, Randy. Not what I recommend, other than what you feel is best. I may recommend a root canal for that same situation, or I may ask, do you want this removed? This gentleman today is somebody that does not like root canals, prefers not to. He doesn't feel it's healthy for his body. Totally agree if that's what he feels. We are going to remove that tooth. He didn't know, to the point where we had called back and forth a couple phone calls, and he still wasn't clear, and he finally came in. So that Smile Virtual app that we talked about in earlier.
That's another video you can check out.
It's an app on our website. You just click on it and send me your problem, maybe take a picture, and I can reply back via video. It's a virtual appointment.
It's really neat.
Yeah.
It's really neat.
But after that, I mean, at 20 minutes after a face-to-face discussion, he got it. It was like, okay. And we moved forward. Didn't hurt. It's been in there over a year. Now it's time to do something. He still hasn't had any pain. My contention is that I can see that. I'm telling you, that's a bigger problem that's going to result from not doing something.
That's something worse.
Which is 100% your choice.
Yeah,
you don't have to do it.
Sure.
You should do something with a root canal or pull it. You tell me what you want.
And that's probably another good reason just to go to the dentist twice, because you may have something going on in there that you don't feel, and you see something or you touch something.
There's so many bad stories about dental appointments, and people are just really, really nervous about coming in to see me. And I think we're pretty relaxed, and we take our job serious. And sometimes, I know Randy well enough now, I would tease him and probably give him a startled look, but we don't do that. We what's bothering you? Nothing.
I would scream like a girl, if he gave me that look.
Did you know you have this bump on your gum? Oh yeah, I did kind of feel that. It didn't hurt. Okay, let me just explain like we just did. Then you tell me what you want.
Yeah, that's always what the patient wants, but you give some good guidance.
And if it was something that I think you were doing really something not healthy for you, I would really stand my ground. But ultimately, you're the last say on what you're going to do and what you are not going to do.
So if you're feeling some pain for some reason, get in to see the good doctor. If it's been a while since you've been in to see a dentist, get in to see the good doctor. Make sure everything's good in your mouth.
Absolutely. Come on in.